Hi everyone, good evening. Since we are using the basal implants on a large scale and I'm giving all the advices and the techniques about the basal implants, in this video I'll just give a description about what these basal implants are made of. What is the content of the basal implants, what is the material it's made of. Okay. In basal implantology, we have two types, that is BCS implants, that is basal cortical screws, as well as compressive implants. Okay, these two are the main type used in basal implantology. Along with that, we have PTI, that is tuberopterygoid implants. So another root surface implants is also available. So usually we have 3 to 4 types of implants in basal implantology. Okay. So let us discuss a little bit about the material, the content. What is the body of the basal implant made of? Usually, for all the dental implants made of pure titanium alloy. That is what we call pure titanium alloy. It's that is what the material they use for fabrication and preparation of the basal implants. There are two types of alloy available. One is pure titanium alloy and another one is the combination of alloy, wherein 90% of the alloy is made of titanium, 6% Al, that is aluminium, and another 4% is vanadium, along with oxidized oxygen is also there in that alloy. Okay, so these are the two main types alloy used in fabrication of dental implants, that is pure titanium, as well as another one, the combination of alloy, that is called as Ti6Al, okay, 4Va ELI. Okay, this is the one. I'll repeat again. The main content of the alloy used in basal implantology will be for the fabrication and preparation of the basal implant will be, okay, Ti stands for titanium, 6L, that is aluminium, that is 6%, Ti will be 90%, and then vanadium, that is 4%, along with 0.4% of oxygen. So totally we call it as, this alloy will be called as a Ti6Al4Va ELI. This is the main alloy used in preparation in the manufacturing of the dental implants. Okay, so the main advantage of using the titanium as a material for the manufacture of dental implant will be, it's corrosion resistant, biocompatible, it will have good adherent property with the living bone, and it's usually infection free. So these are all the properties mainly with the titanium alloy. Since it's corrosion resistance and low density and it has biocompatible properties, it will have good osteo integration with the bone. So these are all the properties of the titanium which enables for good osteo integration in dental implants. Whereas in the basal implants, usually the primary stability we get through osteo fixation. After that, we get osteo integrated with the bone by secondary intention. Okay, so the material used here, I've explained about the alloy material which used for the manufacture of dental implants. This pure titanium, okay, alloy, that is made of completely of alloy, also sometimes used for the fabrication manufacturing of dental implants. But the main alloy will be, the main used in dental implant manufacturing will be, that is titanium 90%, 6% aluminum, 4% vanadium, and 0.4% oxygen. So together we call it as Ti6Al4Va ELI. Okay, so this is the alloy, main alloy used in manufacturing of dental implants. So this is the same alloy they are going to use for orthopedic implants also. So wherever in our body the orthopedic implants are used, this alloy will be used. This is the main alloy used for both for dental purposes as well as the orthopedic purposes. Thank you.